Our normal platelet count is 1.5 lakhs to 4.5 lakhs.
Achha.
Okay. Whenever there is a platelet count is below 1.5 lakhs, then it is called as a thrombocytopenia.
What do we call as dangerously low level of platelet count?
So basically, whenever the platelet count is below 20,000,
Achha.
then and then only we call it as a dangerously low platelet count. Because below 20,000, there is a sudden or spontaneous chance of the internal bleeding. So with the low platelet count less than the 20,000, you can have a sudden spontaneous bruises, internal bleeding like melena, so blood in the stool, recurrent epistaxis means the blood, recurrent blood loss from your nose.
Routine blood tests show low platelets. What should someone do next?
So it depends on the symptoms. A patient is not having any symptom, okay, then in that case it might not be the low platelet. It may be a pseudothrombocytopenia.
One medicine people should avoid if platelets are low.
Blood thinner medications like antiplatelet, aspirin, clopidogrel, and anticoagulants like warfarin and rivaroxaban.
Home precaution for someone with low platelets.
Avoid injury.
In the intricate landscape of modern medicine, few topics like thrombocytopenia demands much clarity. A condition defined by dangerously low platelet count, it stands at crossroads of hematology, immunity, and systemic diseases. From subtle bruising to life-threatening bleeds, its manifestation challenges even seasoned clinicians. Today, we unravel the signs, the signals, and the silent risks that accompany this disorder. Join us as we decode thrombocytopenia with precision, insight, and clinical depth. Joining us, Dr. Chandrakant Lahane, a distinguished hematologist and hemato-oncologist whose clinical excellence has been shaped by over 15 plus years of dedicated practice. Renowned for his mastery, the full spectrum of benign and malignant blood disorders, he brings a rare blend of precision, depth, and a compassionate care. His expertise spans from complex conditions like bleeding to thrombocytic disorders, leukemia, myeloma, and lymphoma, reflecting a command of modern hematology. Dr. Lahane is also highly accomplished in autologous and allogenic bone graft transplantation, a field in which he has consistently delivered outstanding outcomes. With a reputation built on rigorous training, meticulous judgment, and steadfast patient advocacy, Dr. Lahane stands as a leading pillar of Sahyadri Hospital. Welcoming Dr. Chandrakant Lahane. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Chandrakant Lahane. Hello sir. How are you?
Hi, Dr. Tushita. I'm fine. And how are you?
Welcome. I'm doing very good. Welcome on Sahyadri Health Talks. Okay. And today we have a very interesting topic, which is thrombocytopenia. Okay. And we will discuss in depth about it. So before I get into that details of thrombocytopenia, let's I would want to in my last podcast we were speaking about different parameters which comes in often reflects in health checks.
Okay.
And one of the parameters is platelet count, and we are all going to talk about that today.
Yeah, that's why you gave me this topic to me. Okay.
So about thrombocytopenia, when a person sees a routine investigation or something like that, low platelet count is something which might be seen. Okay. So is every low platelet count counted as a thrombocytopenia?
Every platelet count?
Yeah, low platelet count.
So before talking about a thrombocytopenia, that is low platelet, we should know what is the platelet and what is its function.
Yes.
So platelet is a tiny cell, one of the three major cells in our blood. Okay, first is the RBC, second is WBC. And third is the platelet. So platelet function is to stop the bleeding or to form a clot. Okay, whenever there is a bleeding. So our normal platelet count is 1.5 lakhs to 4.5 lakhs. Okay, whenever there is a platelet count is below 1.5 lakhs, then it is called as a thrombocytopenia. There are three categories of thrombocytopenia. That is a mild thrombocytopenia, moderate thrombocytopenia, and a severe thrombocytopenia. Whenever platelet count is between 1.5 lakhs to 1 lakh, so it's a mild thrombocytopenia. Between 1 lakh to 50,000, it is a moderate thrombocytopenia, and whenever it is below 50,000, we call it as a severe thrombocytopenia.
So what do we call as dangerously low level of platelet count?
So basically, whenever the platelet count is below 20,000,
Acha.
then and then only we call it as a dangerously low platelet count. Because below 20,000, there is a sudden or spontaneous chance of the internal bleeding. So with the low platelet count less than the 20,000, you can have a sudden spontaneous bruises, internal bleeding like melena, so blood in the stool. Recurrent epistaxis means the blood, recurrent blood loss from your nose. You have these are the causes.
These are the normal causes. Okay. So I'll tell you something very honestly. Okay. Whenever we hear a low platelet count, the first thing which comes to mind is dengue. Because dengue, we have seen, even the recent incidences of high dengue cases which the city has seen over the past few years. Low platelet count and dengue are very closely associated, but there are many more causes of low platelet count apart from dengue. So how do you explain these, and what are the common conditions which are often associated with low platelet counts?
Okay, so basically you are asking me what is this? Is it similar, the dengue and low platelet? But these are two different entities. Dengue is a disease. There is a viral infection caused by the bite of the mosquitoes, and its symptoms. So it is after effect is the low platelet. So basically, dengue has other symptoms also, like you have a fatigue, you have a fever, you have a headache, you have malaise, bone pains. So if the patient is sick, patient tries to say, I have malaise, I will not go anywhere or something like that. But thrombocytopenia, it is not equivalent to the dengue. The platelet thrombocytopenia, low platelet count has so many different causes of the causes okay, including dengue.
So dengue is one of the major causes, we can say. Okay. One more thing, I mean, correct me if I'm wrong. Okay. So I come from Northeast, and I have seen typically that people in the northern side of the country, we have a typical tendency of low platelet counts. So what is it?
So low platelet count in Northeast area. Okay. So the people who resides in Northeast area, there's UP, Bihar, West Bengal,
in the northern belt.
So their platelets is in the high, their size is on the higher side. Okay. So how the machine, the coulter, which counts the hemoglobin, RBC, WC platelet, it counts on the size. The platelet size is small, so it categorizes into the platelet. Higher size is than WBCs and the higher size is the RBCs. But the people who are basically whose ancestors are from that area, their platelets on the bigger side.
So you're saying the platelet size is bigger.
Bigger, and the machine is counting that is in the RBCs. Okay, if you see the report, that hemogram report, the RBCs are in the millions. So it is in the 10 lakhs. Okay, and platelets we are talking into the normal count is in the lakhs. Okay, so these platelets are counted in the RBCs. Okay, so for these people so it is found in 5% of the out of 100. If I take a 100 people from this area, the 5 people will have these large platelets. Okay, and these people have a platelet count which is normal for them. It will be in the range of 60-70,000 to 1,20,000. So for them it is not 1.5 lakhs. So being practicing in Pune in Maharashtra, there are so many people from this northeast area. Some are from UP, some Bengal, some Bihar, some so they are just wandering here and there. So many general practitioners, physicians, and they are saying that my platelet is low because they have done for the first time their platelet in Pune at the age of 20-25. So in that case, what happens? They just go there. My platelet is 85,000, sometimes it's 98,000, sometimes 70,000. I am feeling weak. So it's basically they should seek the means they should show to the hematologist and get checked their smear, and if it is related to constitutional thrombocytopenia, that is a region related. We also constitutional macrothrombocytopenia.
Constitutional
macro. So because the size is on the
higher side. The size of the platelet is on the higher side.
And we also given the name, it's a Harris syndrome. Okay, so for them their platelet count is 70,000 to 1,20,000.
So that's normal. That's normal. Nothing to be worried about. Okay. Now coming to the next part of it, which is idiopathic thrombocytopenia, ITP. So what is ITP?
ITP is a immune thrombocytopenia. That is immune destruction. Okay. Basically, whenever our body has an immune system. Okay. When we get the infection, some kind of bacterial infection, viral infection. So in that case, our body tries to fight it and get rid of that cell from our side.
Acha.
That is means bacteria, virus. Sometimes there is antigen mimicry.
Acha.
Okay, so antigens which are present on the bacteria and antigens which are present on the platelet, our body thinks it is the same.
Acha.
And then it tries to kill our and get rid of the platelets. So in
Acha.
cases of immune thrombocytopenia, I have a lower.
So in cases of immune thrombocytopenia, it is body fighting against its own platelets.
Yes,
thinking it's as an enemy.
That is the active immune disease, active immune. So our body is acting against our own body. Okay, so in ITP, so the platelet count whenever there is a below 1 lakh, 1.5 lakhs, and till 30,000 we don't treat.
Achha.
We don't treat.
Achha.
So our safe platelet count, what I told you, that the dangerous in low platelet count is below 20,000. But in cases of ITP, our safe platelet count is 30,000. If above platelet is having above 30,000 in a ITP patients, we don't treat. Okay. If the platelet is going below that, then we give a immunosuppression, some medications, second line, third line. Okay, rituximab like, TPO agonist like. So it is better to you when you have a thrombocytopenia, you just go to and meet to the hematologist and just see what is your count.
Visit a hematologist.
Yeah,
to get it
definitely.
Okay, so what's the role of when it comes to the causes of thrombocytopenia? We have understood that there are certain conditions which might lead to thrombocytopenia. What about drugs?
So I haven't completed the common causes of, I think, you haven't asked me, I think, common causes.
Yeah.
So in common causes, we have infections like viral infection. First of all, dengue, then malaria, HIV infection, hepatitis B infection, hepatitis C infection can cause a thrombocytopenia. Some sepsis, bacterial infection, when you have a UTI, some kind of bacterial infection, you can have a low platelet. And secondly, you can have a nutritional thrombocytopenia in cases who is a strict vegetarian and not taking a vitamin B12, because in B12 is we get it from the non-veg, animal source. So in those cases also we get a thrombocytopenia, but in that case we have low hemoglobin and low WBC also. Okay, and third cause is the drug-induced. So that's why I told you that you have missed the about two common
Thanks
causes.
For covering me up there. So what kind of drugs are we talking about?
So any drugs can cause a thrombocytopenia. Okay, but so recent change within 4 to 6 weeks of this recent change. So it's like the most common causes are like patients is on the anti-epileptic drugs, anti-seizure drugs. Okay, that can cause a thrombocytopenia. The quinine, the anti-malarial drug, that can cause a thrombocytopenia. Other medications. So patient is on the anti-seizure medication and who has changed the medication recently within 4 to 6 months, 4 to 6 weeks. In that case, you can think of it as a drug-induced thrombocytopenia. But if you are taking the same drug since long, that 2 years, 3 years, the thrombocytopenia may not be related to drugs. So it may be a other cause of it.
Okay. So if you have a change in your drug regime and within a couple of weeks you see a fall in your platelet
or count. If you have started the new drug for any reason, for diabetes or hypertension or something, so you will have you have to think that it may be because of that. So basically, whenever you go to the any doctor, not a hematologist or any physician, so you should tell me, you should tell them that I'm not having fever or something like that, but I'm having these bruises and something like that. So what will happen? That physician will think of only that common causes, that is infective, but patient is not having a fever. Then why he should be investigated for the dengue or malaria? Then he should be think of that he has started a new medication. So for the anti-TB drugs, rifampicin also can cause a thrombocytopenia.
Okay.
So anyone who has diagnosed with a tuberculosis and who has got this sudden bruises or something like that, and he checked the platelet, and if it is on the lower side, in that case you should check for these things, that you should stop the medication and just see it is increasing or not. Yes, those are the things.
So as you said, right, key common bruises. So when it comes to bruises, we often, I'm saying it from my personal experience. I have a habit of going and, hurting myself very frequently.
Okay.
So these kind of bruises, which commonly happens due to, sudden collision or sudden small inside the house or something like that. Are these bruises also a point of concern? I mean, how do I know that, I might be...
It is related to you or just in general public?
I mean, Yeah,
you and a general
I'm
person.
pretty sure there are many people like me who often hurt themselves and
Yeah,
get
yeah.
Neela hair,
Yeah,
Neela
Nila,
hair.
so it is of concern. But in cases like old age people who has a lack skin or something like that, or they are fair people, in those cases they get sometimes to that.
Yeah.
But in that case, if you check the platelet, if it's on the higher side, then nothing to be worried. But you are having a sudden bruises after trauma, or if you are having a spontaneous bruises, okay, kala nila pad raha hai वगैरह, so in that case you
without
should,
a major
without a touch, you are,
without-
if you are getting a bruises without any injury, in that case your platelet might be below 20,000. That is it is a dangerous low level of the platelets. Okay.
Sir, I also remember you mentioning about when we were having a discussion before the shoot. I also remember you spoke about blood thinners, right? Ki blood thinners can also induce, thrombocytopenia. Now, my question here is, blood thinner these days are quite commonly given, to people. So, what should be the approach for those people who have thrombocytopenia and they also require blood thinners for various
because cardiac conditions,
so what
related
should
to
be, I mean, what is the midway for them?
So first of all, we have to diagnose the cause of thrombocytopenia. If it is related to about ITP, that immune thrombocytopenia, then we have to give some immunosuppressive therapy or some therapy for the immune thrombocytopenia and try to maintain the platelet above 50,000 or 70,000, and then you have to give the antiplatelet. If the platelet is below 20,000, then you should not take the blood thinners like aspirin, antiplatelet or anticoagulation like warfarin or rivaroxaban.
Okay, so if a routine blood test show low platelets, what should someone do next?
So it depends on the symptoms. Okay, so basically when on routine investigations for the health checkup or something, a patient is not having any symptom, okay, then in that case it might not be the low platelet, it may be a pseudothrombocytopenia. In cases of pseudothrombocytopenia, so pseudothrombocytopenia is a is like that in 1 in 1,000 normal people. So we take the to check the platelet count, we take the blood in ED table. Okay, so it is because of that reagent it is causing platelet agglutination. Okay, so in that case the platelet count in that patient is normal, is around 2 lakh 2.5 lakhs. But when you take it into the ED table, routinely it is because we have to see the morphology of the blood smears, means like WBC, RBC and platelet. So because of EDT induced, the platelet comes out to be below 20,000, 10,000. But the patient is not having any symptoms, no bruises or something like that. So in that case, if you take the sample in other bulb, citrate bulb or that heparin bulb, you get the normal platelet count. So basically, if you are not having any symptoms, bruises or something, on routine checkup, you get the platelet. Just ask your doctor to ask the pathologist to see the smear, or just you visit the hematologist. Otherwise, they will end up doing the dengue, malaria, and every other test, CRP, ESR, that is searching for the. So it's a basic thing. So not the common public, but the physician and general practitioner should know, if the patient is not having the symptoms and he has got some low platelet, then the platelet smear should be checked for the platelet count.
Okay, so let's talk about gestational related thrombocytopenia.
So you want to ask me about the low platelet in pregnancy?
Yeah. So these are special situation, low platelet count, maybe liver diseases, gestational.
So we'll try to speak on related to pregnancy and low platelet. So basically, the low platelet in a pregnancy is type that it are most common causes. It can be a preeclampsia, gestational thrombocytopenia or ITP, and rarely the acute fatty liver or HELLP syndrome. These are acute liver failure of pregnancy. And HELLP syndrome, that patient should be treated in ICU or in the IPD status. But for this preeclampsia, gestational thrombocytopenia and ITP, so preeclampsia is the patient when the patient is pregnant, the patient is having the swelling over the feet, her blood pressure is on the higher side, she's having headache. In that cases, you have to monitor, and you have a proteins in your urine, so you have to control your blood pressure and everything, and you should be managed by multidisciplinary, the physician, hematologist and the obstetrician. Okay, so but it is a controllable. So if you timely treat that, then it's okay, no problem. And second, we were talking about the gestational thrombocytopenia. Gestational thrombocytopenia is similar like gestational diabetes.
So it comes only during the pregnancy and it goes off.
It goes off. So gestational thrombocytopenia, basically the platelet count is in between the 70,000 to 1 lakh. It never goes below 60,000, and it usually appears in the second and third trimester. Okay. So basically, whenever the patient goes in the first trimester to the obstetrician, there was the normal platelet count, and in second trimester you get the low platelet count. So they give the reference to the hematologist. Ask them to show to the hematologist
for
in the OPD. So the history is important. You are not having, but in peripheral cases or something, though doctor doesn't do the hemogram on the day of pregnancy. Means they have checked the LMP is missed, the urinary pregnancy test has come positive. In that cases, so it is missed. Then it is difficult for the hematologist also. Okay, is it gestational thrombocytopenia or ITP?
Okay.
So ITP, it can occur before the pregnancy or first trimester of the pregnancy also. But if I don't have previous reports, then it is difficult for the hematologist also. Okay. And second thing, gestational thrombocytopenia doesn't require treatment. It usually doesn't go below 50,000, but you have to check regularly every 15 days. Okay. So, and after your delivery, okay, your platelet comes to the normal within 30-40 days.
So these are all situation based.
And for ITP, ITP and pregnancy, okay. So if the platelet count is above 30,000, we just observe. We don't give any treatment, as I already told, but we have to check frequently. If the platelet going below 30,000, okay. Now what happens? The patient is in the third month, 6 months, 4 months. So in that case, we have to check platelet regularly. Okay. If it is going below 30,000, in that case, we should give a treatment.
So it's a continuous observation which the patient is kept on.
But at the time of delivery, okay, if above 30,000, okay, and the platelet patient is normal, have normal BP or anything, in our institute, we do a normal delivery at 30,000.
So above 30,000, we go for normal delivery as well.
Yeah. And if the indication for the LSCS, as per obstetric indication, there is no indication for regarding the low platelet count. So if it is above 50,000, we go by LSCS also. There is nothing to worry. So whenever you have a thrombocytopenia, if it is diagnosed gestational thrombocytopenia or ITP, then the patient should be delivered in an institution where the hematologist is available 24/7.
Sure. Okay, so moving on to the next segment of it, which is a few rapid fire questions which I ask you. And it is basically, I mean, most of it we have already discussed. Just to summarize a few points. Okay. So platelets counts are low. First thing that you check in a patient. You know that the patient's, that
the patient is having bruises or not. If he is not having, then I will check the smear, the manual platelet count.
Okay. One common cause of low platelets most people don't know.
Nutritional thrombocytopenia, that's megaloblastic anemia.
Okay. One symptom of low platelets that people often ignore. Bruises.
Definitely.
Lowest platelet count at which you panic.
Below 20,000.
Below 20,000. Dengue or ITP, which drops platelets faster?
These are two different things. Okay. It's not a rapid fire. I will answer in detail.
Sure.
So in dengue, usually we have a fever for 1 to 2 days, first 1 to 2 days, and the platelet starts to drop after 3 days. So from day 3 to day 8, there is a dropping of the platelet, and after day 8, the platelet starts to recover. Okay. So day 1 or day 2, you are having a fever. You did a dengue test. It NS1 or NS1 can come positive, but it usually takes positive after 1 to 3 days. Okay. And day 1 you have a normal platelet count, 2.5 lakhs. On day 3 you have 1.3 lakhs. Day 4 you can get 70,000, and day 5 you may get below 20,000. Okay. So there is a rapid drop in the dengue. Okay. And second is the ITP. ITP, you have, sometimes it's a acute condition. Okay. Usually it's acute condition. In there is, you come with the platelet count less than 20,000. Directly.
Okay.
Yeah. So you may have a normal platelet count 1 or 2 years back, and you have autoimmunity, immune disorder right now, and you are getting the platelet below 20,000. So there is such thing like a rapid drop in ITP. Okay. So, but during treatment of ITP, when you give a immunosuppressive therapy, your platelets start rising. It is above 1.5 lakhs. Then we try to taper off the medications. Okay. In that case, we have to check the platelet frequently, like weekly or bi-weekly. If it is rapidly dropping, then we try to maintain that immunosuppression, or we try to give the another medication or another class.
Class of drugs. Okay. Next one is quite interesting, and I'm pretty sure you have heard this quite many times. Papaya leaf juice, helpful or a hype?
Hype.
Total hype.
Total hype. Total hype. Yeah.
Okay. When is a platelet transfusion truly needed?
It depends on diagnosis. If you are having a diagnosis that is a rapid consumption, like a infection, dengue fever, or malaria, or something like that, whenever there is a platelet count below 20,000, we transfuse.
We usually require.
We require, patient requires transfusion. But you are having a ITP diagnosis and your platelet count is 20,000, the transfusion is not helping. You just transfuse, that will be destructed again.
Oh.
Okay, in that case, you have to give the immunosuppressive therapy or IVIG.
So the line of treatment gets completely different.
So basically, depending, the dangerous low platelet count is 20,000, but what is the cause? It has to be.
If it is dengue, then it needs a transfusion.
Needs a transfusion.
If it is ITP, then it needs a different.
But it's not like that. It's not a dengue and ITP only. Both the things.
I'm just saying. But it basically depends on what is the cause behind it.
Yeah, definitely.
And treating the cause is more.
Yes.
Yeah. See, I've also learned it.
Okay.
Okay. One medicine people should avoid if platelets are low.
Blood thinner medications like antiplatelet, aspirin, clopidogrel, and anticoagulants like warfarin and rivaroxaban. But in some cases, you require those medications. In that case, you should consult a hematologist, and then under observation of the hematologist, you should take it.
Okay. Can stress lower platelets? Yes or no?
So my platelet would be less than 20,000 because I'm handling so many patients like leukemia, lymphoma, and like that.
Okay, so the answer is no.
No.
Okay. One quick home precaution for someone with low platelets.
Avoid injury.
Avoid injuries.
Okay. Whenever you are going on this two-wheeler, try to not to ride a bike. You just sit on the backside of the bike. You just wear a helmet. While driving a car, you just wear a seat belt. These are the questions. Someone is playing football, you should not go there. There should not be an injury.
Try avoiding
any form of injury. Okay. Because when you have a low platelet, you get a head injury, then there is a internal bleeding in the brain. In that cases, we can't do anything. Okay. So this is the only option of the transfusion of the platelet.
So avoid any form of injury or trauma.
Yeah.
One most common myth about platelets you want to bust today. Most common myth about platelets.
Most common myth about the platelets. Papaya increases the platelet.
Papaya leaf.
Yeah, papaya leaf.
Okay. Can someone with low platelets exercise?
Yes, why not? So I have already told that above 30,000 in cases of ITP or anything, okay, there is a safe platelet count. You avoid the injury, you can do yoga, some kind of exercise, you can walk and everything. And one more thing, so many people, the myth, I thought I lost my mind that at that time, that platelet are associated with the weakness. Okay.
Achha.
So platelet and weakness, there is no relation. Okay. Because so many people says, sir, my platelet is 20,000, but I just came in the OPD, I'm sitting in front of you, I don't have weakness. So I tell them, most commonly people know the dengue patients. Yeah. So dengue causes the fatigue, dengue causes the low platelet. There is no relation.
No relation. So that's how they connect it.
Yeah. So dengue low platelet doesn't have relation with the fatigue. Okay. But because of low platelet, you can have a menstrual bleeding or some kind of bleeding, internal bleeding. In those cases, your hemoglobin lows. Okay. So because of low hemoglobin, you can have a fatigue. Yeah, okay. But not related to platelet.
Not directly contributing to the fatigue part, but there will be some other cause behind that fatigue.
Yeah.
And it might be associated with a low platelet count.
Yeah, definitely.
Okay. One red flag sign that needs immediate medical attention when it comes to thrombocytopenia.
Weight purpura. So whenever we have a tiny patchy things on our body, we call it as a petichi. And when you have sudden bruises, the kala nila ho jata, we call it as a purpura. Okay. But whenever the purpura is inside your mouth, we call it as a weight purpura. In those cases, we can have a internal bleeding, like a IC bleed, intracranial bleed or intra-abdominal bleed. So you should urgently seek the medical help.
Okay. How often should platelet counts be repeated?
So it depends on diagnosis.
Achha, again.
Okay.
Okay.
So if you are having a dengue,
Hmm.
okay. So for dengue patients, we sometimes we do a OPD basis treatment.
Hmm.
So I just told you that on day 2 you have to check, then day 3 or day 4 daily you check it.
Yeah.
Okay.
Yeah.
And for the patients with the ITP patients, we have treated the patient, we have reached the platelet count above 1.5 lakhs. Then we are just tapering the immunosuppression or the other drugs, second line or third line. In those cases, we should check the platelet count every weekly or bi-weekly. And if whenever the platelet count is stabilized, then we just tell them just after 1 month you come and follow up, and that cases. Okay. And we try to maintain the platelet count above 30,000.
So, sir, this discussion was about thrombocytopenia, and we spoke about so many myths also.
Yeah, I'm happy that you have discussed so many things.
So before we let you go,
Yeah.
and we have a small ritual at Sahyadri Health Talks, which is
Okay.
we ask our guest to share a case which has been challenging or very close to the heart, a case which has left a mark in your memory. So some storytelling. So tell us some
So
case.
I can be a storyteller right now.
Yes, yes. I'm sure you will have lots of stories.
Yeah, there are so many, but it's not related to thrombocytopenia, but which is very close to my heart.
Huh.
2.5 years back, I had one patient, a young lady in the age of 45 to 50, and she was diagnosed with the acute promyelocytic leukemia. So this condition has a very high chances of cure. I'm talking about cure, more than 95%.
Okay.
So it's like that you treat the patient for 1 year and something like that.
The cure rate is very good.
Very good, and patient is not on any medication or any maintenance therapy after that.
Achha.
Okay. So she was recovered after 14-15 days, but she got a fungal infection, invasive fungal infection. So she was admitted in our ICU for 2 months. 2 months she was intubated for 45 days. She recovered because what happens, the diagnosis with higher chances of cure rate, more than 95%, I'm losing that patient. That feels very sad.
Yes.
But she recovered. Okay. And she's fine now. So right now she comes every 3 months, just meet, hi, hello, and something like that. So it is very close to my heart.
So how does it feel to see a patient who was almost at the verge of?
Yeah. So basically the story in that, she was admitted for 60-65 days and in ICU for 40-45 days. So she was like healthy. Okay. Then her health was deteriorated. She was thin and lean, thin and lean. And when she discharged, okay, and after 2 months, she came back, I didn't recognize her. Okay. So she just came with alone only, because and her relatives were coming afterwards. So I thought that who is she? So what happened to you in OPD? Because in OPD, what happens, just we see on the computer that what is the history and something like that.
Yeah.
Okay. And just, oh, sorry ma'am, I forgot. I didn't recognize you. Okay. So that was close to my heart.
That was very close to your heart. Okay. So on that note, thanking you so much for joining us on today's podcast. Before we end this episode, do you have any final message for all our listeners who have thrombocytopenia or are recently diagnosed with thrombocytopenia? What message do you have for them?
So people who has a thrombocytopenia should have a correct diagnosis. So they should visit to nearby hematologist, and there should be a smear examination for those platelets. Okay. And for who has a ITP, and according to the diagnosis, they should take the treatment and should follow the strictly with the hematologist only. And they should avoid injury, who has a chronic thrombocytopenia, so bruises or something like that, and that's it.
On that note, thanking you once again for giving us this time today. We will surely have you again on this podcast with some more interesting topics.
Definitely.
Until then, this is Dr. Tushita signing off, Sahyadri Health Talks.